you don't put your vagina in danger.
Hey, let's be thoughtful about what we put on our vulvas and vaginas.
So I've actually tried this.
No.
Because when I
don't care if your vagina's not shaved. I don't care if your legs aren't shaved.
what are some common myths that you hear about?
There are natural bacteria in the vagina that help keep it healthy. They maintain a pH balance. It's a little bit of the focus can be on like wellness for the vagina when we actually want to think of health of the vagina.
What are some common myths that you hear about vaginas that just like drive you absolutely crazy?
Well, there's a lot. I think, I'm always like, we need vaginas to be in the spotlight, which is great. But then I think with that comes this, it's a little bit of the focus can be on like wellness for the vagina when we actually want to think of health of the vagina. So some of the things are you don't need to use like a cleaning product on the vulva and vagina itself. It's really what I describe as a self-cleaning oven. So there are natural bacteria in the vagina that help keep it healthy. They maintain a pH balance. They have bacteria that can help ward off infections. And when you are cleansing it with harsh soap or chemicals or douching, that actually can disrupt that vaginal microbiome. So I always say like water is best. Make sure that you're rinsing the area when you shower or bathe, and just, with warm water is fine. If you want to use a cleanser, make sure that it's something that's pH balanced, that's non-irritating, alcohol, paraben, glycerin, slurry, all of those kind of like yucky chemicals. And, these are things as dermatologists, we're like, hey, let's be thoughtful about what we put on our face. I'm like, hey, let's be thoughtful about what we put on our vulvas and vaginas, because we also want to maintain the health of that in the long run.
Yeah, I love that. I mean, I definitely don't like wipes either. I don't recommend them to my patients because I feel like it would be like a potential trigger for contact dermatitis. That's something we see.
And then the other thing is like the products that we're using. I mean, if we think about tampons or menstrual pads or incontinence liners, historically these have had bleaches or they have a lot of chemicals in their products. And so I love that there's so much more awareness about like what are we putting on our skin? What are we putting close to our sensitive tissues in our bodies? Do we really need these things, or do we want to kind of be more thoughtful about the ingredients we're looking for? So, I mean, again, I love the awareness that this is bringing. Some of the things I would say I don't love, or like I don't love vaginal steaming or V-steaming. It is
what's vaginal steaming? I've never heard of this. Like, what are people doing?
So literally it's, and people are like, oh, this is an old ancient, practice in Asia, and it's actually not. So it's when right. It's kind of something that just became a little bit more popular, but it's when you sit over a bucket of steaming water and you can put different herbs in it or tinctures, and the steam is supposed to either cleanse the vulva and vagina, to help with fertility, to help with menstruation. Right.
Okay.
I know.
So I've actually tried this.
No.
Because when after I had my daughter, I had terrible hemorrhoids. And I went back to China with my daughter one year, and like I went to see a traditional Chinese medicine doctor, and they gave me these packs. I did it once. I was like, this is the weirdest thing I'm never doing again. But literally, it was like, I was like, what am I supposed to do with these? He's like, you put them in like boiling water and you basically squat over a basin.
This is fascinating.
Yeah,
and how was it?
Well, I mean, I think it's just the fact that like I literally am like squatting and putting more pressure. I did it once, but it was just more like time consuming. I totally believe there is a place for traditional Chinese medicine. Obviously, there's a long history behind it, but like for me, it was just number one, it's time consuming, and two, it was just awkward having to squat over this. I'm trying to think back, like. I don't know if I got any sort of instant relief, but with these treatments, I think it's meant like you're supposed to do a long term to really get the benefits. But now that you've said that, I was like, I totally did it for my anus.
I kind of want to try it. Well, and to your point, Jenny, it's a little bit of, I think that we're taking in the Western world, we're taking these practices out of context of like what is meant to be. And typically in, an Asian culture, if there is like a sitting in period where you can like, it's whole health and wellness and nutrition and nurturing versus like put your vulva over a pot of steaming water. And there's the case of like a case study on vulvar burning, and somebody got a second degree burn. And I'm like, okay, we need to just be a little thoughtful about how we're implementing these in the US.
I was going to say that sounds like a recipe for disaster. Someone does a 20-second TikTok like, hey, steam your vagina. And the next thing you know, everyone's going to the emergency room with second, third degree burns on their vulva. Like this, you if you're gonna do it, you need to speak to someone who's been recommending and doing it, and who is a professional, and to make sure that you don't put your vagina in danger.
Right. And also that it's in context of like, have realistic expectations. Like it's likely not going to help with fertility. It may help with warming and soothing and relaxation, but it's not going to like give your vagina magical powers.
Just like a PSA for people who are going to your dermatologist, do not be embarrassed about what your vagina or that area looks like, because we see all walks of life too. Like, I'm trying to look through that. I don't care if your vagina's not shaved. I don't care if your legs aren't shaved. I do care if you have nail polish on, because I can't see through that. So like, do not care what your medical professional or provider is thinking about you. We're only there to care about your health.
Totally.
Yeah.
I totally agree with that.